I'm going to give a talk on gambling, the brain, and also mention a little bit about COVID and what may have changed. And then at the end, leave about 15, 20 minutes or whatever for questions. So, and I can pull those from the chat if people want to, or they can also raise their hands or scream them out. I don't stand on ceremony, so whatever works. And let me start by mentioning my disclosures. I do have 2 research grants from 2 different pharmaceutical companies that are irrelevant to this talk. As many of you know, sadly, the interest from pharmaceuticals or anybody in gambling research has always been a bit minimal. And so when I talk about what we know and what's been going on in the research world to understand the brain and the biology of gambling, I'm really culling from research all over the world. And it's really quite remarkable, in fact, that as a worldwide problem for folks, that groups of researchers pop up in all cultures, in all countries, et cetera, to really examine this. And so it's given us a really good understanding of the problem on a global scale. But at the same time, you can still see that and I'll highlight, and I hope it's not disheartening, but there's still a lot we don't know clearly. We learn more and more every year incrementally. But again, we could always learn more, couldn't we? You know, I start with this because I always love starting with this. This is my favorite photo about gambling, I must say. And also I start with this because now it's going on 60 years that this was announced in a women's magazine called Look magazine. You know, and we may still be asking the same questions that they were asking. Why do we bet so much? And, you know, then they were talking about the implications of who wins and who loses, and highlighting in this particular magazine for women, the issue of female gambling. But as you see here, the same old issues: smoking, drinking, gambling. And we do know, and we learn a lot about, you know, some of the rates of gambling. We understand much of what goes on in the brain of people with gambling. But yet, you know, when we sit in front of an individual, you know, I think that we are always humbled by the fact that 2 people will describe their entry into it very differently, their relapses very differently, and what keeps them still triggered even in recovery. You know, what they have to worry about. All of that is still quite unique and very on a personal level. It can differ quite a bit. And so when we talk about the data and the science behind it, we're really talking about always sort of averages, right? When people see several hundred folks and what that means. And so I say this by saying that there's always exceptions to the rule, and I can say X and somebody said, well, that doesn't, I saw somebody yesterday who wasn't at all like it, of course. And so, you know, sometimes I don't want to give them the wrong idea that when we talk about these massive collections of data and we talk about, oh, the mean age for this and whatever, that it can still be exceptions to the rule all the time. And so when we look at an individual, we hope that they may have some clues about what they're doing, but as you know, sometimes the people's reasons for why they think they do it is not always necessarily completely the full picture. And the other piece about this too, even when we ask people about why they bet and continue to or relapse, is that why people started a process such as gambling at say 16 or 30 or whenever they started may not be the same reason that 10, 15 years later that they're continuing to gamble. And so, you know, the idea that this changes over time and sort of, you know, to sort of jump to some things, clearly one of the issues now in gambling, but even just in the addiction field in general, that there's been a big debate about whether that addictions, like any mental health problem, is whether we should be thinking about staging illness of these problems, much like one would for cancer, meaning that that the brain may be changing over time, The more I say gamble every day, that the reason I do it might be a collection of things, developmental, etc. And when I talk about the brain and biology, I always try to keep in mind that that doesn't exclude developmental and all the psychological triggers, but all of those things are ultimately filtered through our brain on some level: trauma, neglect, other issues, our personality measures. It all has some filtering through the brain, and why then we pick up chips or start playing cards or whatever. And so it's sort of a bigger global picture to include all of that. But again, I may start gambling at 25 because I'm lonely and I've never felt satisfied and my self-esteem is poor. Is that the same reason I'm gambling at 40? Or has the actual act of gambling modified my brain to the point now that some of those reasons may be less relevant, and now it's actually a different illness? And there's some data for this actually across all addictions that it may change. And so even when people tell us why they do, we always have to ask, well, is that the reason you started, or do you think that's the reason you continue? And and again, aware that it may not be the complete picture, because I doubt any of us have complete understanding of ourselves. I highlight this because these are the criteria, the DSM-5 criteria that we keep coming back to, right? And that the idea here is that 4 of these define gambling disorder, and then one looks at levels of severity: mild, moderate, severe. And as you're all aware, that these run along a continuum. Some people have a very mild form of gambling disorder. Some people don't even meet full criteria, and they might be what we'd call problem gamblers, right? And then they can have a very severe form where they meet all of the 9 criteria, and even the one that's been removed, the illegal acts, which tend to be the one criterion that kind of caps off the most severe issues that people who have, really their lives are so chaotic because of gambling and the consequences that then they resort to illegal behavior to pay off debt or to feed the gambling itself. But as you also notice here, some of these are very physiological. They're very body driven, right? Withdrawal from gambling, or even tolerance, as a factor. Needing to bet with more amount can be very physiologic, whereas some of these call into question a lot of different decision-making aspects, right? How much do you lie about your gambling? How do you perceive chasing, right? How do you really perceive your ability that your loss is based on chance versus how much of it that you see as, I just need to do it better next time, which is sort of the illogic cognitive sort of distortion, right, that can often drive the chasing of losses. And so some of these have a myriad kind of sort of different areas of our brain. The fact that we choose to look at somebody and say, you know what, I'm going to go to work late tonight, where I'm actually know I'm going to gamble, is a very different sort of circuit process of the brain. I'm sort of assessing, okay, what's my likelihood of getting caught by lying? What's my likelihood of being able to do it? Versus maybe chasing losses, where it's like, oh, I just have to sort of tinker with which slot machines I play, etc. And so much more of a reward driven behavior, arguably. They all interconnect clearly, but they may also point to different aspects of the brain that are involved in gambling. And I should sort of highlight from the outset, when we're talking about gambling disorder or any sort of mental health problem, but particularly the addictions, it's not like one part of the brain. It's not like a tumor, right? I mean, where people can sort of say, well, I'm having all these problems. Oh, look, you have a cancer and it's in this part of the brain. When it comes to mental health, we're really talking about circuits that we use every day to make all sorts of decisions. How much do I want something? What are the consequences of my behavior, etc. And that somehow there are aspects of those circuits that may not work the same in somebody who has a gambling problem versus somebody who doesn't. And so there may be discrete sections of the brain that all work generally the same as somebody without a gambling, but maybe a little overactive or a little underactive. So it's not as if it's a new sort of cancer or a new aspect in their brain. So I can't take a look at your brain on an X-ray and see, oh, yeah, of course you have a gambling problem. It doesn't work that way. It's like, okay, the highways that you have in your brain are exactly the highways I have. There's just a lot more traffic on that one highway than maybe somebody who doesn't gamble has, or a lot less traffic on a highway that we need more. So I just keep in mind that again, these differences are subtle, that we all use parts of our brain to make choices all the time. And we all make sort of irrational choices, and we all make unhealthy choices. People who have a gambling disorder, at least as I'll show, really what it comes down to is that they're more likely to make unhealthy choices more frequently and in specific sort of in response to specific problems or sort of dilemmas that one faces. So the brain and just biology in general, I want to sort of, if you kind of think of the brain as the big control center of all of it, right? And as I said, nothing kind of gets, that we experience, right? Anything I experience trauma, I experience this, it all gets somehow processed, remembered by my brain. It all gets re-triggered again by my brain. So the brain is in constant flux as well of all experiences, good and bad, that we experience, some within our control and some clearly not within our control. So why should we care about it? So, and I would sort of suggest, look, why are we focused on the brain at all? Why do, these research studies, and we see it for everything, right? Oh, well, let's take pictures of the brain and see what's going on. And people are like, I don't know. I mean, I just told you, if Bill Smith comes in and says, tell me if I have a gambling problem, I don't take a picture of his brain. But why we try to understand the brain is to not only understand gambling, but those same issues involve a lot of other decisions we make, which may explain also some of the comorbidities, as I'll mention. So, we've all understood that, look, for years now of understanding it, what we call the psychopathology or the illness of mental health, we still have a lot to uncover, right? I mean, we do therapy for folks with gambling addiction. One person does great. And they're like, wow, and somebody else like, I keep working. It just doesn't work for me. I don't know why. I keep relapsing. Now, we could sort of say, well, they're not doing this and this and this, clearly. But some people really do have even when they do it, it doesn't stick, for example. They don't remember things in the same way. They don't have the emotional memory. They don't even have the ability to think about problems in the same way that somebody else does. Doesn't mean it's better or worse, it's just different. And so can we understand sort of maybe different types of interventions based on differences in those understanding the brains? And we also understand that even the same diagnosis has a lot of overlap or non-overlapping issues as well as some overlapping. So if we go back to this criteria for gambling, some people develop tolerance to gambling. They keep betting with more and more. And they may go through withdrawal. Other people never had that problem, right? And so is it the same problem? I mean, I only need 4 of the 9. So I could have this 4 and you could have that 4. So does that suggest that we have different illnesses, even though we both end up gambling? But if some of the basis of my gambling disorder is different from yours, should the treatment be the same? If I'm very physiological, if I feel all this stress and I can feel my heart race every time I go to the casino and it calms me down, as many people do describe, other people get revved up by gambling. They don't find it calming. So should different meditative interventions, mindfulness interventions, should they differ based on even on that? You can sort of see where that just because people have the same diagnosis, that the variables that go into that might be quite different. And so what understanding the biology of something may allow us to understand certain characteristics that are associated with certain circuits of our brain that may help us better target this group of people with gambling need X, this group need Y. It may not be on the individual level, but, oh, Susie Miller looks like this group. This would be the treatment to try. Bill Smith looks like this group based on what he's telling us. And they may also give us ideas of what may predict response to various treatments, and then even who does well long-term. So I think there's a role for it all. I appreciate the fact that when I give talks about some of this, people kind of get a little frustrated, like, well, but we don't know. I mean, you're not telling us X causes this. Let's just address X. And it may not be that simple, one. And I would also just highlight, we don't have that for any addiction or mental health problem. We don't know what causes alcohol use disorder. We don't know what causes major depressive disorder. Gambling is the same, you know, we have pieces of a puzzle. We hope that those pieces sort of keep falling into better alignment. Having said that, strangely enough, we can help a lot of people, which is really great news. I think from a clinician standpoint, we always don't know why we can help some and not others, or help some really well and help others less well, perhaps. But, you know, gambling is no worse off than the other mental health problems, with a lot less, still a lot less focus on it, both clinically as well as research. So, you know, but if we're going to talk about biology and even the brain, let's start with the smallest little piece of us, our genetics, right? Now, we do understand that few individuals who develop gambling disorder, of all those people who gamble. So, you know, it's still a rarer addiction than, say, alcohol problems, right? You know, it's even arguably less common than drug addiction, you know, depending on the data that you read. More people have a problem with drug addiction than, say, gambling. And also, we know that millions and millions of people gamble for fun online at casinos. Why is it that some people are susceptible to developing a gambling problem? And, you know, and a full-blown addiction to it. And we do know that it runs a spectrum from people who have problem gambling to gambling disorder. What we don't want is just to focus on the gambling disorder, clearly, because early interventions, public health should be looking at those people who develop a problem with gambling. But if you look at much of the data, many of the people who meet criteria for problem gambling, a year later, don't. They just sort of, you know, kind of adapt out of it, if you will. They've given up gambling and they just kind of move on. So what's happening with those people, but yet a smaller percentage keep going on and and their gambling gets worse. So by definition, anybody who has a bit of a problem doesn't have to go on to develop a gambling disorder. And so could genetics also give us some clue as to who develops a problem? And so you can look at twin studies, birth cohorts, like all these people sort of born in the 60s or born in the 70s, right? And they may provide some idea of who is vulnerable. You know, the twin studies have been able to look at specific kind of phenotypes, such as gambling, these behaviors, who gambles too much, and then kind of estimate what piece may be genetic versus environmental. And as you well know, this has been a nurture-nature, right? Big debate, but we can actually see that with even folks who are twins who've been reared in different households, and compare those to people who've been reared in the same household, so that you can kind of take account of environment. And what people have learned after years of studying this is still something is heritable in gambling, right? Maybe about 50% of the likelihood that you're going to have a gambling problem is somewhat heritable. Heritable though what? You know, what is that? And there's some evidence from twin studies that maybe substance use disorders are a piece of that puzzle. People, interestingly enough, even with tobacco. So when we ask people about their family histories, we often ask about alcohol or drugs, and we ask the person if they smoke. Do we do enough asking about family history of nicotine dependence? Because that may also explain or help the person understand about their addiction. And I say that because sometimes the family member who's had alcohol sort of rises to the top, right? And they necessitate family chaos and all of this. Whereas somebody who's been smoking for a long time and might clearly be nicotine dependent, we don't always think about, you know, oh yeah, I guess dad did smoke a pack a day for all those years, right? And so, but God forbid, if he didn't die of, have a horrible outcome such as lung cancer, we might not be thinking about even addictions that run in our family. And then what's interesting about this, though, is, and I think it's been complicated over the last several years, we realize that even we always think, oh, gambling is an addiction, just like every other addiction. And therefore, if you have an addiction in the family, you're more likely to have gambling addiction. Well, maybe to some extent. But also people with gambling have more depression in the family. They're more likely to have anxiety disorders in the family. And they're more likely to have obsessive compulsive disorder in the family. So even though we call gambling an addiction, the genetics might point to any number of much more heterogeneous understanding of gambling. Why, so why is that important? There are clearly people who have gambling, and it just being clinicians, right? We see people who have gambling disorder who clearly remind us of people with drug addiction problems, right? They're craving it, they're, kind of jonesing for the next time that they can gamble, and they don't think about any of the consequences, etc. And yet there are people who meet full criteria for gambling disorder who seem like really what they are is depressed, right? And they'll say, it's the only thing that kind of perks up my mood. I do it because I can do it. I don't want to be around people. I can go to the casino by myself, and it helps me feel better for a little while. Okay, it has now become its own problem. I get that. But maybe sort of mood issues or even anxiety issues are what might be driving some of the behavior, much like it does in substance problems, right? We know a lot of people who drink, ironically, because they're depressed, and then the cycle is a vicious cycle, correct? But so maybe what runs in the family is other mental health problems and not directly addiction. Should we care? But maybe it gives us different avenues to understand the treatment approach, which is what it's all about, right? Why we want to understand the brain and biology is to really help people get better. And it may suggest that even the person who's got a gambling problem, who's depressed, might need, say, cognitive behavior therapy focused on the depression, more to a greater extent than just focusing on gambling, right? So some of the principles of addiction treatment may be really less applicable than focusing on mental health treatment, and there's clearly overlap in therapies, et cetera, but that may be more beneficial to help the person who has a family loading of depression, and they may also be doing it because of that. Now, if you even want to get even more specific and figure out on a molecular level, like I do that, like you could actually see a molecule, but, and sort of say, are there molecules in our, brain and body that are specifically associated? We've not found anything. So neither really two massive, what are called these genome-wide association studies with thousands of people that have given blood samples to look at specific problems such as gambling and alcohol. And there doesn't seem now one that kind of looked, at first like it might be somewhat significant, kind of verged a little bit, would be sort of a couple different types of dopamine genes. And that's what I mean on a molecular level. Specific types of genes that give rise to different little parts of either the neuron or the receptor, largely in the dopamine world. So whether down the road we'll see something, I don't know that it's completely relevant at this point, because we don't do sort of genetic interventions, but maybe if science progresses, having that may be useful. I do say that the thing about genetics is, as I've mentioned before, when I talk, is always people are interested in it, family members are interested, but we also don't want to over exaggerate the importance or lack of importance of genetics. So some people will feel that if something is genetically driven, well, everybody in my family has had problem X, I guess I'm destined to as well. I had a patient recently who said, you can't do anything for me. If it's genetic, this is the way I have to be. And I thought, no, that's not what it means. It means that you're more susceptible to something, and it may explain why this kind of got the ball rolling here. It does not, however, have any relevance to whether you can get the problem under control. And so I think that people who seem to have these big family loadings of other addictions or other problems can do just as well in treatment as those who don't. I think of it as education for the person and maybe understanding, maybe for older folks with gambling, maybe if they have children who they start noticing, maybe doing a little bit more risk-taking behavior. So it's a good use of education at some point to talk to the young person about what maybe runs in the family. Doesn't have to scare the person like, oh, I can never, play any kind of gambling games with my friends or ever bet on a game for fun, for fear of becoming gambling addicted. It doesn't mean that, but it just means that parents and young adults as they grow up might be a bit more mindful of what their susceptibility is, much like if somebody has a big family history of diabetes, doesn't mean that the kid can't have ice cream, but they should be more concerned about possible, issues around their own blood sugars and how to kind of guard against it. The other piece of the brain in biology is what we call cognition, how we think through problems. And clearly, as I mentioned, the brain isn't set up to gamble or not gamble in the big of dice gambling, right? But it is set up to make decisions. And what makes gambling so incredibly useful to understand the brain, not just for gambling disorder, but just for any number of issues, right? Because one could argue that how we understand when people play games of chance, essentially, it's kind of how much risk is there versus how much reward. Now, everybody makes a choice differently based on that. Some people love high risk and high reward, et cetera, and any permutation. But that decision-making that we do in our brain applies to everything else in life, right? Should I go to the meeting tonight when it's a blizzard? It's only a block, right? I'm going to drive. Well, there's a little bit of risk, but I really find the meeting really helpful. I'm just talking about general, any meeting or any engagement. So we use the same parts of our brain to make choices all the time. And so gambling is sort of perfectly set as that it taps our natural cognitive processes. Why that's useful is understanding it can also maybe tell us a lot about how people struggle with overeating, how people struggle with obviously drug addiction, but also overspending. As you know, I read an article in the paper about last week saying right now, Americans are deeper in debt than they've ever been in for the last 20 years or something, right? So spending has taken off, and how we make those choices, and they're relating it to COVID and people needing to feel good and all of that. Well, doesn't that sound a little bit, right? That risk benefit on an extreme level is what people are doing when they're engaging in games of chance, but they're doing it to a higher level and higher sort of chaos consequences in their lives, but it still applies. And so one aspect of that is when we decide to not think about consequences and think about the more immediacy of things, and one aspect then is being impulsive. We've all been impulsive at some point in our lives. It's a natural piece that we will respond to how we're feeling right now. I just feel lousy, so I need something right now. Thank you. Oh, it could have negative consequences. I can't think about that. I need to relieve this feeling now. And that's a very common sort of what I'd call a distorted thing when it's done over and over again, that we see in people with gambling problems. And as you're well aware, we see it in all sorts of addictions, right? This kind of impulsive responding. Now, again, just as the footnote, not everybody with a gambling disorder does that, right? Some of them, do not act impulsively or based on just kind of their emotional state in the moment. I'm just saying that it is more common in people with gambling, and it's quite common in gambling compared to, the population at large in terms of how frequently they feel that way, and the extreme nature of that impulsivity. And you can look at this on many tasks if you want to sort of see people and see their cognitive distortions. You can do these kind of go, no-go tasks, stop signal tasks, which neuropsychologists have used for decades. You can do what are called monetary tasks by seeing how people overvalue monetary reward specifically. What's interesting about that is even people who say have problems with overeating and have people, and have other types of impulsive disorders, they also overvalue these tasks. So a monetary reward is still very powerful, even to people without gambling who have associated issues. And then these kind of decision making that we've done, historically too, with the Iowa gambling test, but they all show this. And what you're looking at when you see this impulsivity, again, you're seeing parts of the brain, the part that says, I want, because I feel lousy, or I feel bored, or I just feel nothing and I want this reward. And then another part of the brain that says, that's not a good choice. And that teeter-totter tipping. You also see the emotional part of the brain kind of turn on and say, but I feel lousy right now. I feel chronically underappreciated. I feel nobody loves me, and so I want to do X. And those cognitive circuits that are involved in this decision making may also explain, because they're not unique to gambling only, right? So why is it that we see so many people with a gambling problem who have other addictions? Same circuit. Who have problems with smoking, who have problems often with overeating. Obesity is much more common in gambling. We used to think, well, they're just so sedentary. And clearly that can be the case, right? People give up exercise to just gamble. But there's also the decision-making involved in eating unhealthy foods, which are comfort foods, to the exclusion of healthier options, which may not taste as rewarding, but we know long-term that they are better for us, such as a salad for most people, right? Versus heavy fat kind of ice creams and cheeses, etc. So that same situation can happen. And that's why we've advised people for decades now, right? As they stop gambling and they get better in treatment, look, this may not just be gambling. Be cautious. Be cautious of your choices in life. That what we're trying to do with gambling treatment is not just to fix that isolated problem, but to have sort of an overall healthier approach, right? And so that means that for some folks, you're very impulsive. So I get it. You're not gambling. Good for you. You've excluded blah, 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 right? This is wonderful. But that impulsive side of your brain may still be active, and we don't want it to be like whack-a-mole. The gambling gets better and now something else pops up. Historically, we worried about things like drinking, right? But it could also be other decisions, spending money, overeating, etc. Also, I should just highlight toward things where things are moving, and I know that I've talked about this before. We're still waiting for these things to really become prime time, but they're in further development. So if you can sort of see people using some of these tasks, say a go, no-go task, which is really about how easily people stop and say, hey, these are not good choices. I need to stop my response and not just keep doing it because I've been doing it. If that's how we assess it, and I can say, look, you're really pretty impulsive based on this task. Can I use that task to improve your impulsivity? And so some people have been examining, can we look at tasks of impulsivity and have the person retrain their brain by understanding, like if every time I do something impulsive, the little task, all the bells and whistles go off and like, boop, 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 you're impulsive, right? So can I then start modifying my behavior so I get better at the task, and thereby not just learning how to kind of like, the old phrase, just sort of play to the test kind of thing, but actually by doing so, I'm slowing my brain down, and that circuit that was lighting up, can I slow it down and make it a little dimmer so I can make better choices? And so people have been using the very tasks that we use to sort of see how much time would somebody have to do these, how frequently would they want to, and it's called cognitive sort of remediation. Can I take a circuit that's out of whack and retrain it to be less impulsive, sort of? And people have been seeing good results in trials of this. I see already one can buy this stuff on Amazon or other online. The problem is it's hard to know whether some people just jumped right to marketing things, and how well tested those products are, I can't speak to. But it is still being done in research venues as a way to retrain the brain. And we also see that even some people can be quite the opposite of being impulsive. They're quite compulsive, meaning that they just do it over and over again habitually. This is actually anxious people are very compulsive, right? They may be very inflexible. They can't shift to new attentional issues. They might keep focusing on one thing over and over again. And we see this with people with gambling. They're like, well, why do you keep going? It's my habit. I go there every Friday night, or I go to the bar and do scratch offs every night. I just feel like I have to keep doing it. And so people often, and that may be a very different, and they could be in the same person, a little A and a little B, but people who have a lot of this kind of compulsive habitual response to things, as we see, is maybe kind of anxiety reduction. I can't deal with life. I can't deal with stress unless there's certain things that I do over and over again to kind of calm myself down. As I mentioned before about staging, what we've seen now, at least in the addiction field and to some smaller degree in gambling, is that over time, a lot of folks who have an addiction, who are very impulsive, who do it without thinking, become very compulsive over time. And we actually can see in the brain the whole little shift of a circuit in very kind of millimeter shift. But the circuit goes from one area, which is a very kind of impulsive part of the brain, just slightly to what we'd call a habit. And so who cares? And why should we care? One, it may mean that some people are very different. The biology, the brain, the decision-making is quite different in one group of gamblers versus another. And why is that important? Say if you're doing a group, you may be focusing on treatments that are very good for the impulsive folks, but the compulsive folks are like, that doesn't even compute because I don't think about gambling that way. And so the treatment may completely be missing them. And so half of the group might not get better, not because they all don't have gambling problems, but half the group might be so far along in their illness that it might be a different illness. Now, the footnote to that is, and I wish I had a great answer, is when does that happen? We don't know. Does it take 10 years? Does it take 20 years? Again, on the individual level, it's hard to say. That's where we're trying to move. How do I know when Bill Smith might be more likely to shift from an impulsive reward-driven gambling addicted person to a much more of a compulsive habit-driven? It's not easy to predict at this point, I will say, but we have to be on the lookout for those differences because, again, treatments may differ. And there are different types of treatment for habit. So, for example, there's an old therapy used since the 50s for a range of behaviors. It's called habit reversal therapy. People are now starting to look at this for addictions. It was used in the 50s, people looked at it for smoking, and then it was used for a lot of anxiety problems. But then over time, people were like, maybe a habit-driven therapy might be very useful for people who don't really fully feel like that urge anymore, that desire. And so this may move us into using different types of therapy based on the cognitive underpinnings. So they do tend to be different circuits, as I mentioned, the impulsive and compulsive, but they do intercommunicate. And as I said, the compulsive may be driven by different parts of the brain, and I just highlight a couple parts of the brain, whereas the impulsive seem to be driven by different areas of the brain. Again, areas. The areas are, I show my hands like it's like clear, but it's really through under magnification that one sees it. It's not like way over here and way over here. It's not feet apart. Clearly, your brain's not that big. So we're really talking about millimeter differences, but the circuits carry different neurochemicals and process things differently. And what are some of those neurochemicals? In any piece of the brain that helps us understand reward and choice and all of this, we have probably 4 big ones, although, there are, probably lots of little ancillary ones. Serotonin, which does help us improve our ability for impulsive choice. Now, again, why does that matter? It's not like everybody has the same deficiencies or overactivities. People did try antidepressants again for a range of addictions. They may help some people just kind of make slightly better choices. But it may be a fairly minor group of people. Now, we always talk about dopamine, right? Everybody talks about dopamine. And it's probably still the main player, and it's about reward and how much I may want something. And there's two theories about it, actually. Some say, well, people with gambling disorder have too much dopamine, and they're overly revved up, and so and normal life activities don't interest them because they're already at a 9 out of 10, and life is always about a 4 or 5, and so gambling may take them up to a 10. Other theories are, well, dopamine in gamblers may be a 2 out of 10. And therefore, I just am kind of depressed and forlorn and nothing excites me. And gambling gets me up to a 5 out of 10, which is where everybody else seems to be just without gambling, right? So is gambling helping boost a deficiency of dopamine? Or is it the only thing, if I have an excess, that I actually find that kind of gets me up and over the edge? So it's a little hard at this point to know, and it may be, again, different in different people, but dopamine is clearly our reward chemical, but norepinephrine is about our arousal, about our ability to get excited, and opiates are naturally occurring endorphins, right? People talk about an endorphin rush when we runner's high, and that's also about motivating ourselves to do something because we find pleasure in it, and that makes us want to do it again. So you can sort of see, even when people say, well, gambling's all about having too little dopamine. Probably not. It's just more complex. Bill Smith comes in. I can't get the levels on an individual. It just doesn't really work because to see the levels in the brain are very complicated. But Bill Smith could have a little too little serotonin, a little too much dopamine, a little too little a natural endorphin, or any mishmash. And this is what's made it very difficult, particularly in terms of like medication approaches, to know what may help or not help. And it's just been a little bit more elusive. But when people come in and say, well, I think I've got too much, dopamine, so I'm taking this over-the-counter thing that helps with dopamine. It's like, I don't know that it's going to be that simple, right? And so I always tell people, without evidence for things, I don't want people spending their money on anything. Interestingly enough, we do know that exercise helps, but interestingly enough, exercise tones all of our brain, largely through blood flow. So we get more dopamine at a better tone, I should say. It's not about raising it or lowering it. It's making it more sort of like the perfect sweet spot. Our endorphin system kicks in so that we understand pleasure. Serotonin is improved, and even norepinephrine. So exercise does a little bit on all of them. Having said that, we clearly know people who exercise up the yin yang, right? And they still have a gambling problem. So even it isn't going to be a one size fits all or always that simple, because if it were, then great, we would already be telling people exercise all the time. But clearly marathon runners who are in great shape and do exercise all the time still gamble. Athletes gamble. So it's, again, always a little bit more elusive, so a little bit humbling. But I think part of this is useful from an education standpoint with people, to let them know that we have some basic understanding on some level of some of the players. And what we're trying to always do is delve deeper into understanding it. And I've mentioned a little bit here already, and because of time, I don't want to go on too much, and you can have these slides. But we don't have great ways of seeing dopamine. We could look at cerebral spinal fluid, which is what CSF stands for. And it's been sort of shown that maybe dopamine's off kilter. Hard to say. And some of these receptors, there's lots of different dopamine in different parts of our brain with all sorts of receptors. So it's so complicated. But we also know that things that artificially rev up dopamine may make gambling worse. And everybody has now read that certain medications, the Parkinson's drugs, things like aripiprazole, some of these drugs in some people seem to be associated with worse problems because they may jack up dopamine in certain parts of the brain. Other people use these drugs and they don't have any problems. So again, It's not a simple one-to-one correlation, but it gives us clues. The opiate system, the same way that people have done trials of how to rev up dopamine, because then opiates should be also revved up. You know, maybe the opiate system and pleasure in the brain is different. And therefore, some people have found that things that dampen our opiate system may help with gambling. And that's been one of the focuses of medication treatment for the past 20 years now. Some of the drugs that work for alcohol work for gambling. What have we found from brain imaging studies? And keep in mind, the brain imaging, when we take people in a scanner and we have them sit there, and we can look at parts of the brain, and then we have them do little computer tasks that they look at, and then we sort of see which circuits light up. And all of these things have shown some, in that reward circuit particularly, some problems that people with gambling look like the natural rewards for things may not do it. A typical, a piece of cake may not rev them up the same way it does somebody else. Gambling seems to bring them up to a certain level. Multiple pieces of cake may do it, right? Excess. And so this may explain overeating, as we've also seen in gamblers, but everybody's got a different reward thing that's often imprinted from childhood, early exposure to things that we find rewarding. And so there seems to be something that gambling is making up for something in the brain that maybe day-to-day life, I get excited, oh, it's a beautiful sunset. Doesn't that make me feel wonderful? That may not be rewarding enough for somebody with gambling, which is why even on a behavioral level, one of the challenges that we've had is what healthy behaviors may take the place of gambling. And most people with gambling disorder really do need to try multiple things, because as a clinician, what I might think, well, you know what, 10 other people found this rewarding. That particular person sitting in front of me said, doesn't do it. I don't find that rewarding. And so what is going to make their life filled with reward, a certain healthy reward, clearly, right? As opposed to the unhealthy, quick, sort of naughty reward of gambling. And so some people really do need to keep working at that, not because they're not trying, it's because their brain is just not registering a lot of typical rewards in the same way. And we've seen this in many, aspects of the brain when we look at and even how people attach importance to things. People with gambling often don't see it that way, in the same rewarding way. And you can read through these slides, and if you have questions, always let me know. And then there's also this part of our brain, the amygdala, which represents sort of our emotional memory to things, and it allows us to understand cost-benefit analysis and the likelihood of something bad or good happening. And this part of the brain is often affected by early life trauma and gets a little bit off kilter because of that, and develops differently. And this is where we may see with gamblers with more traumatic pasts that their understanding of consequence and loss may be very different from someone else. And therefore they don't process the possibility of loss from gambling in the same way. And therapy may need to sort of venture down a little bit different kind of trauma-based focused therapy for some people. And again, we don't need to do that by looking at their brain. It's based on what they tell us clearly. I just highlight this because it sort of says what they tell us seems to have a reality in what we see in many people when we scan their brains. Now, I want to sort of say, too, that one of the things that we've borrowed when we understand the brain is that a lot of people around the country have been looking at gaming. And so it's not a bad way to also, gaming and gambling, as you well know by now, have this huge convergence. There's a lot of Venn diagram, right? They share a lot of similarities. People play these games all night long, and they gamble in these kind of cryptocurrency, fantasy ways that have a lot of gambling similarities, to the point that games actually, the technology used in all these kind of high quality games look a lot like what we see with gambling technology and what people use for online gambling. But what that means is we don't have to necessarily always see them as two separate problems. People who have a severe gaming problem can tell us a lot about gambling, and vice versa. And we do see that the brains of people start looking very similar. People who gamble, people who game. And this has been done from research around the world, particularly Asian countries, that have really sounded the alarm on some of the gaming to be at a much greater level. But even though we talk about them, it's very different, gambling and gaming, and one is clearly, less monitored, there are less prohibitions in place because they technically kind of bypass gambling statutes, because they again use things that aren't directly money often, such as virtual currencies. But they also, again, clearly tell us a lot about what may be going on in people with gambling. And these are some of the comorbidities and some of the possible sort of, as I mentioned, the whack-a-mole behaviors. And we have social casinos now and video games that, try to sort of use basically that decision-making circuitry of the brain, thinking, well, for young people particularly, who may have gambling issues or like gambling, they're going to be drawn into some of this gaming and vice versa. And because gaming is so much easier to access at a younger age, one of the worries that we have moving toward the future is, are young people who have gaming issues rewiring their brain to be so impulsive that those folks are then going to have other types of addictive problems, even though now we're like, oh, little Billy likes to play games all hours of the night, right? We sort of recognize that there's something kind of complex going on there and problematic, even though it doesn't have that same financial sort of chaos that gambling does, which often is why people come in for treatment, right? When they've lost and they're in debt. So gaming might even drag on longer for people in a problematic way because they don't often feel the repercussions to the same degree until school starts falling apart clearly, which then is when parents often bring them in. It's a little harder among the young adults at the university level, where we see a lot of gaming problems as well. But the point is too that if that circuit, and it appears to be a lot of those same reward decision-making circuits are involved, it's on hyperdrive and it's constantly being reinforced. So what's going to happen 10 years from now? Are we going to have more gambling problems, or is it just going to be gaming? Fine, then we're ready for it if we start kind of shifting some of the gambling focus toward gaming perhaps. But is it going to just a whole host of other types of addictive, sort of problematic reward behaviors that are out of whack? And part of the issue about it is, if the circuit's being revved up, how do our therapies, how do our cognitive behavior therapies keep step with that and keep trying to thwart it and modify it as it's even more out of control? And how can we, from a public health intervention, even try to intervene younger on gaming before it becomes a gambling issue? And, just some data, 50% of games on Facebook include some gambling themes, interestingly enough. And that a recent review a couple of years ago found that even among the video games, a good chunk met criteria for what would be called old-fashioned gambling, even ability to cash out your winnings, which is then really verging on perhaps should be regulated, much like any game of chance, such as a gambling game. Is it a risk factor for gambling? That a lot of young people who have now come in reporting gambling problems say that they also had, they started with video gaming. So, and it goes the other way too, that video gamers are talking about, yes, they've also gambled. Now, maybe some of it's inconsequential gambling, but some of it clearly won't be. And so how to kind of start nipping that in the bud at a much earlier. What we do know is that the only studies that have been done looking at who predicts these young people who game, who goes on to having a gambling issue, risk takers and impulsive people, the same kind of that reward circuit. And by risk taking, again, that impulsive, I would prefer to make a possible huge reward immediately, negative consequences be darned. I don't worry about those. I'm taking big risk, even if there's big consequence involved. And so those two variables that we see in gaming. And again, I just toss this in there because it's the same circuit and it doesn't have to be like, oh, this is a gambling issue. We are starting to see that same circuit hijacked by these games as well. So it's just, I think, a cautionary tale as we move forward, again, from public health educating people, if we're going to do education among drug addiction for young people, I think that's appropriate. It always has been. We need to do education around gambling, but also gaming. I would say among the whole kit and caboodle of impulsive behaviors, that any of these could lead to all of them potentially, but also that same circuitry can be hijacked easily by drugs, alcohol, gambling, etc. A couple of things too to be in mind, keep in mind is that we wonder whether COVID, for several reasons, we've seen an overall increase, not massive, not like 80 million%, right? 4% people did find that the gambling increased, and these were the online gambling folks. And it did tend to increase with alcohol use under stress, but treatment seeking did not increase. So we had this social isolation. And again, people were, sort of those folks who liked online gambling seemed to ratchet up there. But again, a lot of impulsive behaviors such as the alcohol. And to bring into that part of the amygdala, our stress response, how we deal and how we cope emotionally, we see again that stress did tend to be increased. Now, did it drive some of it? Or was it a consequence of some of it? That's not clear. Clearly, if you're gambling more and you're not working, then stress is going to go up. But also, if stress goes up, you may do more online gambling. The COVID may have actually helped in an odd way some purely land-based gamblers, but we've also seen that some of those folks shifted over into online options. And because of the online option, again, it's much more like a video game. It's fast. You can do multiple games at the same time, multiple types of games, if you have multiple screens. So again, is COVID sort of going to set us up now, even after it passes and people go back to things, that we're going to see more online gambling at a higher level of severity due to some of the impulsivity that's kind of been bred by the isolation and the technology of the games themselves. What does all this mean in terms of treatment? I won't go on much into this because we only have a few minutes, but it clearly, if we're talking about the brain and reward, this is why ambivalence is still such a huge problem with folks online, more so to some degree than land-based gamblers. But this idea of like, I want help, I don't want help, I want to quit, but I don't want to quit. I really want to just get rid of the problems of gambling, but I don't really want to quit the behavior. A lot of ambivalence, because the brain has really been trained to enjoy the reward when it happens, right? Sometimes the reward is the escape. Sometimes the reward is the win. It can be any number of things. Even intermittent reward is incredibly enticing. So even if I win one time out of 100, my brain remembers that very strongly. And so, well, I want to quit now that I've been losing, but maybe I'll win tonight, and then I want to do it again. And so understanding a little bit of that brain circuitry allows us to better understand that ambivalence, that it's not just about somebody not wanting to sort of, get better. It's not that type of, petulant resistance or something. It's really this push and pull often happens. And that what we're treating largely has been the behavior, gambling, right? And all those brain abnormalities are yet still elusive. Genetics, etiology, the cause of it, still too elusive to treat. Cognition, though, has been a bit maybe a better target in some fundamental way, at least to include with the behavior. Because if all we do is stop somebody from gambling, it's clear if that circuit is sort of in hyperdrive, many people will find something else, as we've all known. Now we just have, I think, a better kind of a cognitive and behavior, a biological basis for understanding that. But maybe going upstream and attacking the cognition, the impulsivity, in some fashion through good old-fashioned cognitive behavior therapy or through some of these cognitive remediations may allow us to attack that cognition that may then wipe out the whack-a-mole problem that we often see with gambling. And cognitive behavior therapy can be structured either to focus more on different aspects of cognition, different aspects of behavior. As you all know, it's the treatment of choice for gambling in terms of psychotherapy. Why? Because it still has the lion's share of evidence. Many types of therapy have shown some benefit. I highlight just cognitive behavior therapy for purposes of time because it has the lion's share of data supporting it. A type of that is exposure therapy as well that's been used. You have these slides. Motivational interviewing, which has been used across a lot of addiction, is a cognitive therapy, and works on long-term planning deficits by understanding the long-term negative and positive outcomes of the behavior. So you know all this, but I think by sometimes introducing the circuit aspect and the cognitive aspects just as a baseline of why people may be where they are when they walk in the door, it allows people to understand at least, why are we doing this? Why are we doing a motivational interview? Yeah, I get it. It's what you do, doc, but why are we doing this and not X, Y, or Z as a starting point, at least? Contingency management has also been used as a way to understanding risk reward and giving. This has been used a lot more in the substance field, right? So if you come back with a negative urine, then you get something for it, right? It's getting a reinforcement of good behavior, essentially. In the gambling field, contingency management just needs to try to avoid, kind of a lottery system, right? It can be something with the family. It can be an acknowledgement, some type of reinforcement for, say, not gambling for a week. And that helps retrain the brain from understanding a different type of reward as a reinforcement to not gambling. And these can be done through self-directed ways. Again, people who are very impulsive, who may not want to see a therapist, there are lots of self-directed ways using workbooks and online programs where people can do some of the same therapy and maybe at least start it or work with their therapist by doing some self-directed aspects that they may go to and back and forth from, and not feel like, well, I didn't go and I did go and I didn't do the homework, and therefore my therapist is going to be disappointed in me. This may give them some extra help at home while they're working through that perceived consequences of their behavior before they come back to treatment. All of these types of therapies can be done in groups, as you know, with the caveat that some people are just going to have slightly different circuits. And even for online gambling, many of these cognitive aspects have been designed now for online interventions, self-guided online CBTs, other types of online training. Kind of, what's the old phrase? If you're going to go hunt a tiger, go find where the tigers are. I think that's an old Korean phrase. I use that just by analogy by saying, if you're going to try to treat online gamblers, maybe online is the place to do it. And so this is where some of the therapies that have been developed are sort of trying to take the treatment to the person. And then medication, as I mentioned, you can dampen the opiate system, some data. You can dampen the reward system, glutamate that affects dopamine by using an all-natural substance, as we did many years ago and continue to use for a range of addictions. And then even the future of maybe medication options may be targeting higher order cognitive aspects. This is an Alzheimer's drug that's been used for impulsive decision-making in non-Alzheimer's folks and has been used in gambling to show some benefit. So I just kind of get through that quickly because that's probably less directly relevant, but I just wanted you to also be aware that medication choices may also be further developed as options if we understand better the circuitry as just an augmentation to what people are doing in terms of therapy. So I wanted to leave time for questions, gripes, etc., whatever you feel like you want to sort of share here. So.
Thanks, Jon. We did have a question. The person asked, how long does a gambling problem basically stay? How long does it take for a gambling problem to disappear from one's mind? And I mean, that's a big question.
It's a great question. And, I think in part, the reason I can't speak to, the reason people ask that question in general is that there used to be this old chestnut out there based on some good data that drug addiction, if people stopped drug use, and all these scans of the brain showing that people light up when you mentioned the word cocaine, right? That their brain lit up far less, or was a kind of a more typical brain, we'll say, if they spent 12 to 18 months sober from drugs, right? Abstinent from all drugs, that the brain tended to normalize after about a year to 18 months. So the sort of the old chestnut for gambling is it's probably around that time. We don't have a lot of long-term studies, some very scant data. About a year, we see a lot more normalization of the brain. The best analogy I've often found on brain scans for gambling is probably cocaine addicted individuals, more so than alcoholic individuals. And so if we use that by analogy, it's probably 12 to 18 months. Having said that, I've treated some people who've been abstinent from gambling for years, and they'll still say if they see a casino billboard, a little urge still kind of percolates. So clearly their brain isn't necessarily completely typical in the way a non-gambler's brain will be. So I always try to tell people, look, your brain will get healthier in time. But even if it's not completely like Aunt Mildred's, who never gambles and has never had a problem in her life, so what, right? Even if you have a little bit of an inkling when you go by a casino billboard, okay, you learn to cope with that, much like anybody learns to cope, right? We see this with people who have overeating problems. Maybe when somebody is having a lot of chocolate cake, they like, they have a little, yearning, but then they can still have a lovely meal, eat healthy, and enjoy themselves, right? So that just because the brain may still always be, in some people, a little bit more revved up, a little bit more vulnerable, it doesn't mean the quality of life can't improve hugely. And after all, I think that's kind of what the whole thing is about, isn't it? To sort of have people overall be healthier and enjoy their lives more in a healthy fashion.
Right. So another person asks, some of the assessment and curriculum options seem somewhat outdated. What are your thoughts on that?
Curricular options and assessments for gambling then?
Presumably, yeah.
Yes, I think they are a bit outdated. I will say that. I think, we're sort of habitual, aren't we, right? Training and writing down every type of land-based gambling people do, and maybe less relevant for a kind of a bird's eye picture, again, about how people make choices, about how people, are impulsive or not, or a lot of the other driving forces. But I think some of the old sort of SOGs, sort of subcategories of all the types of gambling is somewhat, less relevant. It's kind of like when I train young doctors about alcohol assessments, and they're always, how many ounces does somebody drink? And, this used to be our big thing, how many ounces each day, except for we never really knew, because nobody knows how many ounces are in a glass at home anyway. And my grandma could tell you if somebody largely has a problem with drinking or not, right? It's the consequence of it in their lives. But if we want to do treatment, maybe we can get less about these granular details of gambling per se, and more in the bigger picture of how people make choices and why gambling, has been an unhealthy choice, and how that may dovetail into other areas of their lives. I mean, think about how many relationship issues do all of us as clinicians, end up addressing in people with gambling problems. And yet you kind of realize, wow, their relationship issues are kind of the same unhealthy choices that they bring to the casino, right? I mean, it's a lot of the same thing. And as opposed to, well, I'll treat all of this kind of only specific to gambling, and then we're going to send you to somebody else for the relationship decisions. And then we're going to, maybe less productive than say, we're noticing these patterns. You're all about sort of, in the most simplistic way, right? You're all about immediacy of your reward. Do you see how that's the same in gambling as it is in your choice of partners and blah, 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 right? And I find that then people kind of like, oh my goodness, right? I mean, this is kind of me globally, right? And so how can we help address that? Maybe more pertinent. So we have about 4 minutes. I am curious about what you're thinking in terms of children, because it seems that with the advancement of technology, kids were not, certainly my generation was not exposed in the same way to potential addictive
practices. So what are your thoughts in terms of what we should be doing as a community to minimize the harm for children as their brains are developing? And, you know, we don't want kids not to play the games, but, you know, what are your thoughts on that?
You know, I think, you know, I don't have any great probably answers or cure-alls for it. I'm concerned as well. I'm worried that technology and just the constancy of it is developing our brains. And maybe that's a good thing in many ways, right? Maybe 200 years from now, everybody will be very impulsive, but in healthy, great ways, right? I mean, I don't know. But I do think that, you know, there's a phrase over one of the ancient Greek temples. If you read old ancient Greek stories, and it said nothing in excess. And as just a basic principle of life, and I really appreciate schools and parents who are kind of learning how to teach kids, and I think we just have to do it bigger from a public health, how to kind of disconnect more frequently, right? How to use imagination, read a book, go out, run around the yard and pretend you're, you know, a pirate or whatever kids do, and not necessarily see everything so immediate, so fast, and so, you know, like I know kids 10 years old who have multiple screens in their bedrooms and they're playing multiple games. That it's not their fault, or their parents' fault, but I think unbeknownst to all of us, that does change the way that we see the world when we then leave our bedrooms, right? Mm-hmm. We don't deal well with anything slow and slow paced, and what that includes exercise. Ugh, I don't want to do that, right? Waiting for things, even education, right? Why should I go to college? I can be a millionaire. I'll just bet it all online, right? So it factors into a lot of our choices. And I think educating people around, we don't want to be alarmist and like, ooh, all bad, but I think just caution, maybe, you know, kind of divesting one's portfolio, doing things that are slow, as well as these other things. I think the other piece too is that from a treatment perspective for adults, it gets very hard. And I think we all need to be working on what our options are. You know, it was actually fairly easy in the big picture to exclude people from land-based casinos. That was often helpful as a starting point. Now people, as soon as they're walking out of your office, are back on their phones doing something. And when you say you can't do that, block these with gambling software, all of these social media things get around the gambling software because they're not really gambling for money. They're gambling for virtual money. So we have a lot more work to do from a behavioral side to know how we can keep people who want help from having all that constant access to it. It's challenging.
Great. Okay, we have 1 minute left, but somebody asked, are there any studies on how culture may affect impulsivity? Is there anything? That's another small question.
You know, it's brilliant. And no, none that I'm aware of. Okay. But one assumes that the more technologically developed, this is an assumption that people have been debating as a starting point theory, that technology helps us be more impulsive, helps or hurts us being more impulsive. So less technology developed countries probably have less impulsive behavior. And that's a working theory that I think, you know, the problem is that we don't see a lot of cultures anymore that are completely isolated to really anthropologically study in that way. But I think we can make better understanding of the cultural influences without a doubt.